We recently became aware of the incredible case of Virginia, a teenager with epilepsy. Virginia, who you have helped become seizure-free after successful brain surgery. This was achieved using a combination of methods and tools in your epilepsy program, of which MEG technology played a vital part. Please tell us why this case was particularly interesting from a medical perspective.
So Virginia, yes, came to us, and she was having seizures for a while, and she underwent a kind of a phase 1 evaluation, which we did. The MAG was very helpful in her case. So when we did a MAG scan on her, she had you will look at the picture, and you will see that she has a large cluster of a MAG dipoles in the right frontal lobe. And interestingly, we had looked at her MRI very carefully, and we didn't see anything of significance in it. It looked normal. But when we got those dipoles, we went back and reviewed the MRI again. We thought that we were seeing some blurry margin part of the gray matter there, and we were suspicious that there may be a cortical dysplasia down there. So that's another feature of the MAG scan, that once it gives you the information, you can go back and always review, and what looks normal, you may be able to find an area which could be of interest for the seizure onset zone for you.
So another fascinating aspect of this case is the fact that the patient's mother used her initiative to find out more about treatment methods and tools across the country. So turning to you, Kate, thank you for joining us. We hope Virginia is recovering well after surgery. We'd like to find out, how did you come across the Neuroscience Center and their team of neurosurgeons?
Sure, thanks. It's great to be here with you all today. And Virginia's doing great. Her surgery was about 3 months ago, and she has not had a single seizure since her surgery. Virginia struggled with uncontrolled epilepsy for about 16 years, and by our count, she had about 13,000 seizures. So as the parent of a child who had been struggling with that for a long time, I followed lots of parents, doctors, and researchers on social media. And it was in doing that I came across Dr. Malik's colleague, and then contacted him about having one of those pre-surgical evaluations.
So in your view, having been exposed to MEG technology now, would patients with neurological disorders benefit from more access to information about MEG and how the technology is being used across the world?
Yeah, I think so, absolutely. For us, we had visited dozens of hospitals, seen dozens of doctors. We had multiple tests, all kinds of imaging, and the doctors were closing in on where they thought her seizures were coming from. They sort of described it as being certain, but not pinpoint certain. And so for us, the MEG was the final piece of our puzzle. And I think it could be that for a lot of people. But even just the approach to research and the communication and everything was so different. So we're forever grateful for that, and we're forever grateful to MEG for finding something that nothing else could.